Good morning. My name is A Georgiou. I will present instead of my colleague Marietta, but it's okay. Thank you for your introduction. So, as we know, ambulatory blood pressure monitoring during the 44-hour interdialytic interval is recommended as the gold standard for the diagnosis and management of hypertension in hemodialysis population. But despite the advantages, it's still perceived as a method with limited applicability due to many reasons: absence of reimbursement in most countries, patient discomfort, and previous upper limb atrioventricular fistulas. A recent survey on the feasibility and tolerability of 48-hour ABPM in hemodialysis revealed that approximately 25% of patients refuse to undergo ABPM due to reasons of discomfort and very high demands of the method. And among the 321 patients that performed the ABPM, approximately 10% did not complete it due to discomfort such as sleep disturbances and itching. Therefore, there is a need of studies that use a more limited set of measurements in a smaller time in order to extend the use of ABPM in the hemodialysis population. The aim of our study was to assess the diagnostic accuracy of fixed 24-hour ABPM recordings during both the first and the second 24-hour period of the interdialytic interval with 44-hour blood pressure in hemodialysis patients. 242 patients performed ABPM from 5 different dialysis centers. Certain inclusion criteria: age more than 18 years old, treated end-stage kidney disease with a standard thrice-weekly hemodialysis schedule for over 3 months, and informed written consent, and certain exclusion criteria: chronic atrial fibrillation or other arrhythmia, non-functional atrioventricular fistulas in the contralateral brachial arm, modification of dry weight or antihypertensive treatment during 1 month prior to enrollment, cardiovascular events, or history of malignancy or any other conditions with poor prognosis. Our patients performed 48-hour ambulatory blood pressure monitoring, 4 hours during the dialysis session and 44 hours from the interdialytic interval. And we tested the systolic and diastolic blood pressure of the first 24-hour without hemodialysis period, first 24 hours including hemodialysis period, and second 24-hour after the dialysis, the day after dialysis. In our statistical analysis, Pearson coefficient of correlation between each of the examined index and 44-hour blood pressure were calculated to assess the validity of their respective indices. Blunt-Altman plots where the difference between the values of each metric and 44-hour blood pressure readings was plotted against their averages. We tested the diagnostic accuracy, and we did ROC analysis of each of the studied blood pressure metrics. Here we see the baseline characteristic of our patients, mainly Caucasian and male. And as we can see from the correlation analysis, as shown by the very high values of the Pearson coefficient, all studied parameters show a strong correlation with the 44-hour systolic and diastolic blood pressure. In the Blunt-Altman analysis, very small differences were observed between the study parameters and the 44-hour systolic blood pressure, namely minus 1.7 millimeters of mercury for the first 24-hour without hemodialysis, minus 1.19 for the first 24-hour including dialysis, and plus 145 for the second day after dialysis, with limited 95 confidence intervals. All of our studied metrics, as we can see from the high values of the case statistic, show great diagnostic performance and very high sensitivity, specificity, and positive and negative prognostic value. Oh, sorry. And from the ROC analysis, as we can see from the very high values of the area under the curve, more than 0.9, all our parameters showed excellent diagnostic accuracy. In conclusion, 24-hour ABPM recordings during either the first or the second day of the interdialytic interval are strongly correlated with, show high specificity and sensitivity, combinations for and display excellent agreement according to case statistic with 44-hour blood pressure. These findings suggest that ABPM recordings of either the first or the second interdialytic day could be used for hypertension diagnosis and management in hemodialysis patients, and future research efforts are needed to assess the association of these blood pressure metrics with cardiovascular events and all-cause mortality in the population with high burden of cardiovascular disease, such as hemodialysis patients. Thank you.